Total knee replacement. Stretch, or regaining your range of motion. This is the part of your education in which we discuss your ability to regain the motion within the knee. The purpose of the knee is to allow the leg to bend and straighten halfway between the knee and the hip. If the motion in your knee is compromised, the purpose of your knee is lost. This is the most important part of your rehabilitation early on, is to get the motion back into your knee. Gaining motion in your knee requires good management of swelling and good management of pain. The following exercises are ranked level 1, level 2, and level 3. You should be able to perform the level 1 exercise very well and with good form prior to advancing to the level 2, and perform that well prior to advancing to the level 3. Your therapist will help you in your progression. Level 1 stretch. While sitting in a chair, with a sock on your foot so as your foot to be able to slide easy on the floor, lift your leg with your hands and use your hamstring muscles to help bend your knee into position, achieving a stretch. As your knee limbers up, you can pull the foot back further and further. Your goal is to make a little progress every day. When your time stretching is completed, straighten the leg back out a little bit so you can stand and move on. Level 2 stretch, only to be done after level 1 stretch is mastered. In the level 2 stretch, you'll slide your foot back as in level 1, and then you'll lift yourself on your chair and scoot your bottom forward. This will increase the intensity of the stretch. To ease off the intensity of the stretch, simply shift your hips back. As your knee range of motion improves, you can start with the foot pulled further back, shifting your hips forward in the chair. Your goal is to get your knee directly above your toes, as if your toes were against the wall, your knee would be touching the wall. Once you've achieved this stretch position, we can work on posture and a seated hip hinge that you'll learn about in the activity level of your education. Level 3 stretch, only to be done after level 1 and level 2 have been mastered. In your level 3 stretch, you'll sit sideways on the chair and shift your hips over so that the leg that you've had surgery on is off the side of the chair. You'll bring your foot out and around behind you, trying to get to where your upper leg is straight up and down from your body. This will be bending your knee while the hip is in a relatively straight position. Please note there is no pressure on the kneecap at this time. The knee does not touch the floor. To get back out of this position, simply shift your weight to the right and bring the leg back around. Common errors you'll want to avoid is letting the foot go way out to the side and then dropping the knee in, twisting the knee, or bringing the foot way too far back and taking the hip into a little bit of extension. Slouching is also not recommended. Focus on your body posture, sitting up tall, keeping your hips straight so your upper leg is in a straight line with your body. Work on your breathing, with the ultimate goal to gain a little bit of motion each day. Remember to keep the pressure off the knee. Don't kneel on the knee during this exercise. This concludes the educational portion on stretching or gaining range of motion back in your knee. Remember, the goal is to gain a little bit of motion each day. And also remember, to gain motion, you're going to have to manage your swelling well and manage your pain well. Good luck, work hard, and we look forward to your successful outcome.